Hi everyone and welcome to Global Health Conversations, a podcast where we explore how global decisions, diplomacy, and development cooperation shape the health systems people rely on every day. If you've ever wondered why some countries can offer affordable, accessible healthcare to most of their people while others struggled for the basics, the answer is not just medicine or money. A lot of it happens in negotiation rooms, in diplomatic meetings, and in agreements between governments, international organizations, and other actors. That space where foreign policy, development cooperation, and health systems meet is what we call global health diplomacy, and it has a huge impact on who gets care, what gets funded, and which health systems become stronger or stay fragile. My name is Hany Helmy. I'm a clinical pharmacist turned health policy and international relations specialist, currently pursuing a Master of Global Affairs and researching global health diplomacy and how it can support stronger health systems and universal health coverage. Today's episode asks a central question: how can global health diplomacy and international development cooperation actually strengthen health systems and advance universal health coverage, especially in low and middle income countries facing overlapping political, economic, and health challenges? We'll be exploring how bilateral donors, multilateral institutions, emerging actors, and the private sector work together. To dive into this, I'm honored to be joined by Dr. Hany Helmy. Dr. Hany is a global health and development leader with experience across Africa, Asia, and the Middle East. He has worked on health policy, financing, and system strengthening with bilateral and multilateral partners, and has also worked in humanitarian and advocacy settings. He previously served as Deputy Director of the USAID Vietnam Office of Health, overseeing programs in HIV, TB, global health security, and health system strengthening. And he has since moved into the private sector, working on policy, partnerships, and universal health coverage from a different angle. Dr. Hany, thank you so much for joining me today on Global Health Conversation.
Thank you so much, Judy. It's my pleasure. Thank you so much for having me.
Thank you. To start off, I'd like to ground the conversation in what global health diplomacy actually looks like in practice and how it connects to the broader development cooperation system. So from your experience, how would you describe a global health diplomacy in practice, and how does it intersect with broader development cooperation?
Great question. So, global health diplomacy, as you mentioned, it's a big terminology, but when you actually break down what it really is, it's basically alignment of priorities across different sets of actors from different backgrounds, with different priorities. So you'll have a number of different actors. You have governments who care about national outcomes. You have donors accountable to their political mandates. You have multilaterals working within global frameworks. And then the private sector that comes with a driven sustainability and scale agenda. So the role of diplomacy in global health is to really bring all of these actors together, but more critically, in ensuring that you don't lose the sight of national ownership, because all of these actors, by the end of the day, are working towards improving national systems. And in sync, trying to make sure that all of these collective efforts in all these different countries are collectively contributing to the global well-being and health. So in practice, when you look at how these things actually translate, diplomacy is less about the formal agreements and the accords and the frameworks, but really it's more about sustaining coordination that really respects the sovereignty of all of these individual countries while enabling collaboration in a way that unlocks innovation and unlocks global solidarity.
You've said it perfectly. So how do bilateral and multilateral actors typically influence national health priorities and health system reforms?
So influence is always present.
Yeah, of course.
It's always think of influence, we think of it as a bad thing. Sometimes when we look at how influence is perceived, the most important element here is how influence is managed to be constructive in a way that moves the bilateral or multilateral agendas forward. So in my experience, what really worked is embedding, if you're looking at health priorities, embedding these priorities within a bilateral or multilateral framework as a part of a comprehensive engagement cooperation plan is what makes things work. When you look at health as a standalone topic or domain, this is where things tend to get siloed and lose this multi-sectoral approach or benefit that you get working in concert with different sectors. So for example, when I was working in Vietnam, working on health cooperation, the most important part for me was to look at how our health programs not just serve the health sector, how it also improves the economic development sector, how it supports cultural development sector, how it affects security, how it affects tourism, how it affects the FDI in the country, how kind of infrastructure gains do the countries get when their health systems are improving. So when you try to isolate health from the broader development cooperation frameworks, this is where things get really limited and restricted. The more you embed these health interventions in a comprehensive framework that is obviously agreed by both governments or whatever multilateral framework framework you're working under, this is where you see the most benefit, because all of these different sectors eventually work together in a more in a whole of society approach, if you will.
Yes, 100% agree. So now that we've framed what global health diplomacy looks like conceptually, I'd like to move into your direct experience working inside a major bilateral agency. So in your former role, you were USAID Vietnam's Office of Health Head. And how did the diplomatic and strategic considerations shape decisions on health system strengthening and primary health care in your daily work?
Once again, I think the most important factor was to make sure that we are working to ensure that bilateral priorities are at the heart of all the decisions that we make, or all the investment decisions. So for us, the most important element was what Vietnam was looking for in terms of building their health system. How do they prioritize their own health agenda? And when we were looking at primary health care to advance the primary health care agenda, at the same time, the government was looking at advancing the primary health care agenda. So this came as a natural fit. There was a priority, an investment priority from the agency side on the other, and the government was already naturally trying to advance the agenda. So when we started this conversation, it felt natural. It didn't feel like there was a push or we're trying to impose something that didn't really fit the national agenda. And because what works by the end of the day is what governments want, is what partners, what national governments want, is really these things. These are the programs that really fly, scale, and sustain. So that's the most important thing. When we were looking at our health programs, we were obviously looking at the broader government-to-government partnership, the big framework, as I mentioned earlier. What are the big objectives for these partnerships? And then when you try to break down these topical or sectoral areas, you look at how to align priorities based on the funding available and at the same time what the key national priorities are, so that we want these partnerships to succeed. We want to see the outcomes of these programs reach the most people, advance the government's and the country's overall economic capabilities. So it's really important to make sure that we're totally in sync between what we're trying to achieve on a framework level and what countries are really looking for.
Yeah, that's great to hear from a practitioner. So this actually brings me to the next question. So I was gonna ask, was there a moment when you felt those diplomatic dynamics really pushed a program in a particular direction in a way that you were happy or concerned about? Obviously, you were happy about something. So can you just tell me an example?
If I go back to there were other examples, maybe not in Vietnam, but previous experiences. I think one of the interesting, I would say, projects I worked on was pushing the NCD financing agenda. And at that time, there was historically the focus has been on communicable diseases. All the major funding was going for communicable diseases, and very little went to NCD financing. And non-communicable diseases, or NCDs, are now the leading cause of mortality, if you will, all across the globe, and even more so in low and middle income countries. It's not like it used to be 20 years ago, where communicable diseases were the main drivers of mortality. So sometimes you need to get lucky with the agendas, right? You need to be in the right place at the right time. And when I was working on the NCD financing agenda, there was already a global appetite to really start having these conversations and see how we can start turning the tide on prevention. We want to focus on NCD prevention and bringing governments together and bringing multilaterals together. Bilateral partners didn't historically work in NCDs. People are starting to realize that addressing NCDs was going to be very important to advance the overall health agenda. You cannot really keep focusing on one of these infectious disease areas and expect the health system to flourish over the next 10 years.
Because you're just looking at one side of the health system.
Definitely. I mean, these vertical health programs were very, very effective in building systems and capabilities beyond their specific functional areas. But by the end of the day, you need this horizontal approach, this integrated approach to improving systems. And addressing NCDs is going to be it's very hard to keep focusing on treating NCDs, because the bills are just going to keep increasing and increasing. And our health budgets are not catching up with the rise of cases in NCDs. So what you look at is that you're trying to build these financing frameworks that help tackle these diseases early on, so that you can try to focus on the prevention agenda the more than you focus on. Obviously, you still give your attention to treatment and care, but you're trying to focus on...
Because it's cheaper. Prevention is so much cheaper, and then dealing with the aftermath of the curative side of healthcare.
100%, because you will still have to deal with the curative side. You'll still have to treat people with this disease, but
you need to prevent this from even happening.
You need to reduce that pool so that the overall envelope is able to cater to everyone. Fund, right? So at the time, we started looking at, the UN was looking at putting together a multilateral, multi-partner trust fund led by the UN.
Yeah. When was that? I'm sorry to interrupt.
I think this was 2021.
Yeah, so that was after the pandemic.
After the pandemic, because at the pandemic, really, it was definitely an infectious disease, right? You're looking at.
Of course.
And surprisingly, it was the first time you unveil the burden and the magnitude of NCDs, because NCDs really changed the trajectory of the pandemic.
Yeah, of course, because people with NCDs suffered the most from the infection. Yeah.
And the terminology of NCDs and the syndemic between NCDs and communicable diseases and COVID specifically, it started triggering conversations at the global level, at the multilateral level, on how we need to urgently act on NCDs in a way that doesn't just serve NCDs, but it actually will help build resilience.
Yeah, actually, I think a pandemic, it was kind of a stark reminder of the importance of prevention.
100%.
Yeah. We were all focused on the curative or the treatment and medications. And I think that the pandemic was like a reminder to everyone that prevention is the most effective thing that we can invest in to prevent actually people from getting more and diseases. So,
absolutely. And yesterday was World Health theme is focusing on One Health, right?
Yes.
That was another topic that has been
was booming after the pandemic.
It was in practice for decades, right?
Yeah, of course.
But it was marginalized. There wasn't much attention. It was named different things, so it didn't really capture the actual essence of what this topic is really about. And One Health really is the intersection of, or the understanding of the interconnectivity of animal, human, and environmental health, right?
Yes.
And
some sort of a holistic approach to health in our planet.
And even though when you look at it, One Health is a framework to address emerging infectious disease threat, right?
Yeah,
this is the main focus, but also it's a thing that you can absolutely utilize to advance non-communicable diseases as well, because the food we eat, the air we breathe, everything that affects our well-being is connected to animals, is connected to the food, is connected to the air. So I think over the next decade, the concept of One Health will evolve to really capture a lot of elements within the non-communicable disease area than it has been already focused on just emerging health threats.
Yes. So moving to our next question, I want to ask about, based on your experiences in Vietnam and in other regions, of course, what are some common opportunities and challenges that middle-income countries face when using international cooperation to advance universal health coverage and stronger health systems?
So international cooperation, international assistance, whatever the framework you're looking at, it comes with challenges. Obviously, it's resources coming into the country in a way or another, but the biggest challenge the national governments experience is aligning the national and local priorities with whatever funding mandate is coming with these resources. So I think the most successful models that I've seen is where national governments were able to negotiate the scope, the magnitude, the functional areas these resources are coming with, to be able to push the national priorities on the top of the priority list while still making sure that it's a win-win for whatever funding stream you're looking at. So the idea here is to make sure that with all these different actors bringing in resources to one or other for X country, the most important thing is to have a clear national strategy and make sure that all these different actors feed into that strategy one way or another, and not just be receiving any specific funding mandate or a specific directive to spend money in a specific pot. Obviously, these things exist. Some governments, or in the bilateral case, or some multilateral bodies have specific spending mandates that they just can't deviate from. But by the end of the day, all of these programs are intended to support local priorities. So there's always room to shape or tweak these cooperation agreements in a way that optimizes the national level priorities and make sure that you're trying. Obviously, there will be duplication, there will be fragmentation.
Yeah, of course. But it's fine.
It's inevitable. But the most successful countries are the ones who are able to reduce these redundancies and make sure that they are able to bring together all of these different actors in a coordinated framework that optimizes the use of these resources, while obviously making sure that they're building their national capacity to increase their domestic resource mobilization, to make sure that these, whatever cooperation or assistance resources they're getting, they're actually working their way towards sustainability and self-resilience.
Yeah. So I'd like to bring in another piece of the picture, which is increasingly important in both practice and theory, non-state actors. So since we've talked about governments, how do you view non-state actors such as the private sector and civil society fitting into the landscape of global health diplomacy and development cooperation, especially in these times where the development sector is struggling with the multiple issues?
So, yeah, this is a very interesting component of the global health architecture because, as you mentioned, the global health financing landscape has changed drastically over the past year. But even before that, the role of civil society, for example, I'll start with civil society. Civil society, their role has been indispensable in making commitments happen on the ground. So you have your World Health Assembly resolutions, you have your UN General Assembly political declarations.
Yeah.
And then what really makes a difference in how quick and effective these commitments are actually translated is a very strong civil society back home in all of these countries that was able to advocate, to support the people, to support the governments in translating these commitments into reality. So advocacy, civil society advocacy, I think is one of the most important elements to actually translate these political commitments to actionable outcomes on the ground. On the other hand, private sector, this is where your innovation, your capabilities, your resources, the role of the private sector has been really indispensable, especially more so over the past decade or so, where you're seeing a booming rise in technology advancements.
Yeah.
And there's so much that the private sector can offer to help address public sector solutions. So you will see how the number and quality and scope and magnitude of public-private partnerships are expanding. And even more so, I think, over the next decade, where your traditional development financing pots are depleting or reducing.
Yeah, of course. Yeah, perfectly said. So, from your perspective, what does it look like when these actors contribute positively to health system strengthening, and what are some of the risks if the roads aren't well governed?
Definitely. I mean, there's always a risk between any two parties. There's always a risk of conflict of interest. There's a conflict. There's always a risk of misalignment between, as I mentioned, but that's not just restricted to non-state actors. It's also with a government-to-government relationship. I have priorities, you have priorities, I have funding. Okay, how are we going to make sure that this funding addresses both of our priorities in a way? And I think this is the success formula, is making sure that all of these engagements, whether is it a government-to-government engagement or a private sector with a government engagement, ensuring that you are building mutually beneficial agreement. It ensures that your private sector act, especially I keep mentioning private sector in that example because there's always been the focus of, ensuring that you get the private sector and they can contribute with their CSR contributions or ESG contributions. And that model, it worked obviously very well in many cases, but I've seen how it could be sometimes used as a box to check, and I did my part. But to meaningfully engage the private sector, you need to make sure that you're engaging them in a way that is still considered a win for them and is sustainable. Because the private sector wants to see positive outcomes, not just for their own business interests, but for the society, because the better the economic
the better the system is,
the better everyone will.
It makes everyone's job easier.
Will do well, right?
Yeah.
So ensuring that the environment frameworks are in place to optimize the partnerships between private sector in a way that makes sure that you're sustaining these partnerships and not engaging in a ad hoc engagement.
Just do one project and check it out of this. Yeah.
Exactly. And I think that's one of the biggest things that the private sector, I think, also appreciates. Because it can really go the easy way of just doing little engagements here and there, and you lose the real value of the private sector contribution.
Yeah, exactly. So looking ahead 5 to 10 years from now, how do you see global health cooperation and diplomacy evolving, especially in the world of geopolitical rivals and constrained aid budget? Or in other words, how do you think we're moving forward toward? Is it a more fragmented landscape, or do you see opportunities for new kinds of cooperation?
I think there will be fragmentation for a while, till the dust settles, if you will, on the global health financing landscape. But as we mentioned earlier, there would be a much larger room for private sector engagement. There would be a much larger room for philanthropic engagement.
Yes.
Some huge philanthropies have been already engaged and shaped global health landscape in a way. Their role will be even more, I think, important, I would say, in the next phase, because the problem with changing architecture is that so many countries weren't ready for quick transition, right? Funding agreement. So the essence of the transition is very important.
Yeah.
The ultimate goal of development cooperation is to end its existence in a way or another. But this needs a very carefully tailored transition plan. And right now, so many countries are finding themselves having to deal with huge budget gaps. So on the short term, I see a very immediate role for philanthropies to be able to support with these gaps. And on the long term, I think private sector would still be a key actor to make sure that you're not providing funding or donations. You're making sure you're building sustainable financing relationships that advances the system, advances the private sector interests. And by the end of the day, all of that work, the single most important factor is to make sure that the people are getting the resources, the access, the quality of care they need. And that's only possible if we engage in partnerships. Governments cannot do everything alone. Not funding, not service delivery. There's only so much that governments can do.
Yeah, it's so hard because the world is so interconnected. But sectors are interconnected. And
totally agree.
No sector can do it on their own, actually. We all need to cooperate.
Most definitely.
Yeah. So finally, what advice would you give to young professionals interested in working at the intersection of diplomacy, development cooperation, and global health?
I think that was me many years ago. I was very interested in this very intersection myself. But looking back, there's a very important skill that I think right now, technical skills are very important. It's extremely important to have depth in one of the global health domains. Would that be epidemiology? Would that be or health systems, financing? There are multiple domains, but equally important are what you just mentioned, the breadth of thinking and making sure that you know enough about other sectors that converge with global health. Because the world right now does not operate in silos when it comes to global cooperation. All of these different
all sectors currently are kind of super connected to each other.
100%. And actually, that's the reality that's been there forever, but we just are starting to see it.
We're starting to realize that.
We're starting to realize it. So hone your skills in one area, technical area, but make sure that you're building your knowledge and understanding and familiarity with other sectors. Make sure you understand enough about the food systems, about agricultural development, about economic development. Because to really succeed in this global health cooperation, diplomacy space, you really need to see the world with the lens that is way wider than just the health sector.
We need to have this panoramic view of what's happening so that we can fix our healthcare systems.
Yes, because by the end of the day, we are working to make sure that, back to the first question, global health is the collective action of all of these different actors with the sole benefit of unlocking quality access to care for people that live everywhere with a full, equitable, affordable access. And that's the way we can ensure that that this is the way we measure, are we succeeding in global health or not? Because global health can be abstract. The way we actually succeed or measure success is that we make sure that we see tangible changes in the most remote community. If you don't see that, then whatever is happening at the global framework level is not really working. We need to revise that.
Yes, 100%. So Dr. Hany, thank you so much for this rich and very thoughtful conversation. So today you've helped us see that global health diplomacy isn't just an abstract idea. It's something that shapes priorities, funding decisions, partnerships, and the way health systems evolved in all countries. You've shown how bilateral and multilateral actors, non-state partners, and changing political and financial dynamics all come together to influence whether countries move closer to universal health coverage or improving their healthcare access, or do they remain vulnerable. So for our listeners, this discussion connects directly to the themes of multilateral and bilateral cooperation for development, how different actors, institutions, and financing mechanisms interact, and what that means for real people's access to care. Dr. Hany, thank you again for sharing your experience and insights with us. And to everyone listening, thank you for joining us on Global Health Conversations. I'm Judy Hamdi. Till next time. Thank you.